events in these sleep apnea patients, and so you need to keep them in your office longer than you would a normal patient. Analgesics, Mark talked about this before in his talk, but IV acetaminophen, something we're not going to use in the office, but in the hospital setting, these are the drugs that they want to give these patients because they know narcotics are bad. Again, that's trying to reinforce the fact that you don't want to do moderate to severe sleep apnea patients in your office. So if you give IV acetaminophen, you're not going to have an increased risk of hypoxic events or obstruction post-operatively. And those are the doses. Besides IV acetaminophen, you can also use some non-steroidals. IV ketorolac. There's actually an IV ibuprofen. I didn't know that. But this is, these are the doses that can be given. Excellent analgesia, but it's not going to increase the risk of desaturations. How much this would be, I have absolutely no idea. Would it even be something practical that you could use in an office? But it is available in hospitals. Tramadol, post-operatively, this phenylpiperidine opioid can be used, so it's going to be less of an opioid risk for a patient than, say, hydrocodone. And actually, dexamethasone. Oral surgeons give dexamethasone all the time for swelling, but it's an excellent agent for emesis, prevention or rescue, but it's also good for pain. And that's rather surprising, but it has an opioid-sparing effect. And so if you give this dose, this is something that can decrease the pain requirements in your patients post-operatively. So a little IV Decadron goes a long way. It has multiple effects for us. Now, it's going to take several days for these patients to normalize with their sleep, and during that time, it would be a good idea to have them on their CPAP machines. And so what are the guidelines in the literature for, is it safe for us to do sleep apnea patients in the office? It's 12 o'clock. Why don't we stop here, and I'll just finish this up right after lunch, and that way it won't hold. Nobody will become hypoglycemic. Okay? All right, so upstairs on the